September is PAD month, but a lot of people don't know what that means. So it's a good time to find out what PAD is, and we've come to the right place and to the right person. We're talking with Dr. Scott Brannan. He is the Chief of Endovascular Surgery here at Modern Vascular in Mesa on McKellips. I bet you get that question a lot. I mean, what is PAD? We've never heard of it.
Yeah, you're in good company not knowing exactly what PAD stands for. The acronym stands for peripheral arterial disease, which refers to disease of any artery outside of the heart. And most patients, even those patients who have PAD, have never really even heard of it until they make it to an office like ours. The effects of PAD are frequently silent in their early stages.
Oh boy.
And the consequences of PAD can be catastrophic for some patients. So an awareness month is very important to get people in mind that the disease of peripheral arteries is a potentially catastrophic disease that is frequently silent in the early stages.
So what are the symptoms and what parts of our body does it affect?
So when we talk about PAD, we're talking about any artery outside of the heart. So it may affect the carotid arteries that supply the brain. It may affect the renal arteries that supply the kidneys. And most frequently, it affects the arteries of the lower extremity. So the arteries of the pelvis even, the arteries above the knee, below the knee, and even below the ankle. And the at-risk groups are specifically slightly older patients, anyone over 55, especially patients over 65.
Okay.
Patients who are diabetics, type 1 or type 2, and as we all know, there's been a huge increase in the number of type 2 diabetics over the last decade or so.
Yes.
Anyone with an inflammatory disease, like patients who smoke and patients who have high blood pressure.
Okay.
Those are the patients that need to be aware of PAD. During the later stages of disease, patients develop symptoms. Frequently, symptoms involve cramping, either at night or while walking or walking upstairs, for example. In some cases, patients will present already with breakdown of the skin. Because the arteries are responsible for supplying oxygenated blood to the tissues, we can get skin breakdown and ulceration. So sometimes patients will present to us already at the stage of ulceration, which is just a few steps away from requiring an amputation.
Wow. What happens if it goes untreated?
So the worst outcome that happens if it goes untreated is major amputation.
Oh my goodness.
And that's what we're really dedicated to preventing. That's the purpose behind this PAD Awareness Month, is to help people to catch the silent and early symptoms as early as we can so that we can treat them effectively, frequently with just medical management, not even requiring surgery.
Well, here at Modern Vascular, tell us about the procedure. Tell us what you do when someone walks in the door.
Sure. So when somebody comes in, the first thing we do is take a thorough history and then do some basic testing of the velocity of their arteries and the elasticity of their arteries. Hopefully, we're catching the disease early enough where we can do some lifestyle modifications, control blood sugar, control blood pressure, and not require any procedure. If it's already gone to the point where an artery is closed or severely narrowed, we do a minimally invasive procedure that's performed through a pinhole puncture, either in the foot or sometimes up at the groin. And we're able to open arteries through that little tiny pinpoint access using small balloons and some different techniques like a diamond encrusted drill bit, for example, to drill through heavily calcified arteries and open them, restore them to a normal caliber, and restore that oxygenated blood to the tissues. We have really seen a very significant impact on our PAD patients since the epidemic began. Patients are sometimes more afraid of COVID than they are of their peripheral arterial disease. And so they're not getting follow-up, they're not getting seen when they're symptomatic, and we have seen the percentage of major amputations go up significantly, not just here, but across the country. And vascular experts, we've had 3 meetings in the last 3 months about this epidemic within an epidemic of increasing major amputations across the country because of care-seeking behaviors that have been decreased by COVID and the risks of COVID.
For more information, you can visit modernvascular.com, and there you can take a very easy assessment to see if you're at high risk for PAD. modernvascular.com.